They found something monstrous between his ribs. The doctors who treated him couldn't believe what they saw, because what they had on their hands was terrifying. Narendra Kumar was 18 years old when he arrived urgently at a hospital in Allahabad, India, because his stomach pain attacks reached unsustainable levels. Narendra had always suffered from them, in addition to constant weight loss. But he would have never suspected what was really causing those discomforts. Be that as it may, the boy was really in pain, and his abdomen gave him no respite. On the other hand, his parents were very confused. Had they overlooked some important illness of their son? Soon, that doubt would have an answer, as the boy was attended immediately by the doctors, who decided to investigate thoroughly. They were determined to solve the mystery. Narendra received help from Dr. Rajeev Singh, who decided to perform a series of tests to gain more clarity on this severe stomach pain. The young man underwent an ultrasound and a full-body CT scan, but the doctor still couldn't identify well what the real problem was. He could see a significant spot located in Narendra's abdomen, relatively close to his rib cage. But as he was missing some information to complete the diagnosis, he decided to operate on the young man and clear all doubts. The resolution of this case would be much more disturbing than the initial symptoms. After 3 hours of surgery, the doctors were able to see what Narendra had stuck in there, a thing that looked like a hairy snake, 2 meters long. How did it get into his abdomen? It turns out that while Narendra's stomach grew over time, what he had inside managed to hide well enough so that neither the boy nor his parents noticed anything. That's why what the doctors found in the surgery was quite grim. They removed a mass of about 20 centimeters long that had teeth, an attempt at a head, a few bones and a strand of hair that, when stretched, measured an impressive 2 meters in length. In fact, what Narendra was hiding in his abdomen was nothing more and nothing less than his twin brother who was never born. That is to say, it was a case of fetus in fetu. During his mother's pregnancy, one of the fetuses basically inserted itself inside the other through the umbilical cord and developed as a parasite that drained vital energy from his healthy brother using his organs. In this case, the fetus was alive and fed on Narendra through a structure connected to his blood supply. According to the doctors, only 2 or 3 cases of this type had been recorded in India. But in the end, there was much relief for the patient, as Narendra was able to escape his severe pain attacks. Only in a rather traumatic way, right? Remember, always be eager to know more.